Eric Schabert, DO, checking in. I wanted to put out some information to hopefully try and clarify which individuals can benefit most from COVID-19 vaccination in light of recent data, particularly because some statements from the FDA and from the Florida Surgeon General have greatly restricted access to these vaccines and have muddied the waters a little bit as far as who should be getting them. First off, during the most recent outbreak that swept across the country starting in June and still is continuing to this day, we have seen a marked increase in the number of ER visits and hospitalizations in children under the age of 2. My previous recommendations put out a couple of years ago now were against vaccinating children for the most part. We definitely need to get kids under 2 vaccinated now, because they are definitely at risk for severe disease. Additionally, individuals over the age of 65 continue to be at high risk, with that risk increasing as age elevates and with additional risk factors. There are certain risk factors that continue to generate high risk in the population from age 2 to age 64, and anybody in those age groups with the following conditions definitely should seek vaccination. So we're talking about cancer, cerebrovascular disease, chronic kidney disease, chronic lung diseases such as asthma and COPD. We're talking about chronic liver disease such as MASLD and steatohepatitis. Hepatitis C as well would fall into that category. Cystic fibrosis, type 1 and 2 diabetes, disabilities such as Down syndrome that are genetically based, heart conditions such as atrial fibrillation, congestive heart failure, coronary artery disease, HIV, mental health conditions requiring powerful psychotropic medications, dementia, Parkinson's disease, obesity, morbid obesity, prolonged physical inactivity, especially resulting in sarcopenia, that is loss of muscle, like profound loss of muscle, pregnancy, recent pregnancy, primary immunodeficiencies, current and former smoking, prior organ transplantations, tuberculosis, and use of immunosuppressive medications. These are all people that definitely should be pursuing updated vaccinations when they become available later this year. There are also conditions that suggest we might have benefit if you're in that 2 to 64 group. These would include individuals with epilepsy, hemophilia, individuals that are overweight but not obese, individuals with sickle cell disease, with active substance use disorders, and some other pediatric underlying conditions that it's a broad list and a little bit too complex for me to go into here, but something to bring up with your doctor if your child has some unusual childhood illnesses. And there's a few more where we've previously put these into high risk, but the evidence is now a little bit more inconclusive. And that would include alpha-1 antitrypsin deficiency, bronchopulmonary dysplasia, hepatitis B, hypertension, and thalassemia. Well, I hope this information helped clarify things for you for a little bit, and hopefully this is something you can take and move forward with. Thank you so much, and I'll see you next time.